Good evening, everyone, and welcome to the Society of Surgery of the Elementary Tract. I'm Wadal Rafai. I serve as the chair of the SSAT Research Committee, and I'm also the Regional Chief Surgical Oncology at MedStar Georgetown University Hospital and the Vice Chair for Research. We're excited to have you today on our first SSAT webinar and research grant writing workshop, tools and practical tips for grant writing and preparation. We're thrilled to join and esteem speakers with us, along with my moderator, Dr. Pooja Ketan from Georgetown University School of Medicine, and Dr. Pablo Serrano from McMaster University in Hamilton, Canada. Please mute your microphones to keep the background noise to a minimum. Be mindful of the background noise, and please position your camera properly. We would like to limit distractions and avoid multitasking throughout the webinar itself. Feel free to ask questions using the Q&A feature at the bottom of the screen. The SSAT was founded in 1960 as the Association for Colon Surgery. The mission of the SSAT to lead and advance the science and practice of GI surgery. Our vision is a global community of GI surgeons advancing the research, innovation, and advocacy to the benefit and the interdisciplinary patient care of GI conditions. The three categories we'd like people to leverage and take advantage of: an active membership, which is $155 plus $75 initiation fee. There's a candidate membership of $20 for surgical residents in an ACGME approved program, and a post-resident GI fellows, and a medical student membership for those who are in good standing at an LCME accredited institution. The SSAT membership are broad that include access to the Journal of GI Surgery, a deeply discounted early bird registration to the Digestive Disease Week, which is an annual and a robust and outstanding meeting, access to apply to awards, grant scholarship, and traveling fellowship, and then multiple leadership opportunities. Please don't forget to save the date for the 2021 DDW meeting. It's a virtual meeting that will take place between May 21st to May 23rd. And last but not least, the SSAT award and grant deadline is coming up. We positioned this webinar today to enhance the preparedness of any applicants and help them prepare their applications by learning from prior awardees and leaders in the field. Our moderator, Dr. Serrano and Dr. Ketan, will introduce our speakers, who are Dr. Daniel Chu from UAB, Dr. Sajid Khan from Yale University, Dr. Jeffrey Matthews from University of Chicago, and Dr. Evie Cartman from University of Wisconsin in Madison. A copy of the webinar recording and slides will be available from each presenters and will be posted on the SSAT websites following the conclusion of the webinar. Please look forward to an email when the recording is available online. I'd like to again acknowledge my moderators, Dr. Serrano and Dr. Ketan. I'd like to thank our speakers, Dr. Matthews, Khan, Chu, and Dr. Kirchman. I also would like to thank the SSAT and LK for their outstanding work and efforts throughout this process. I'll give it now to Dr. Serrano to introduce our speakers and moderators. Thank you.
Thank you, Larry. So our first speaker is going to be Dr. Daniel Chu from the University of Alabama, who's going to talk to us about applying for an SSAT grant, the process, review, and score. Go ahead, Dr. Chu.
The screen. Okay, great. Well, thank you to the SSAT and the entire organizational committee for this opportunity for me to share some thoughts on applying for SSAT grants. And I'll be discussing the process, the review, and how to interpret the scores. I have no commercial disclosures, but do have many grant failures and many lessons learned from each of these applications. And I have been fortunate to receive the SSAT Health Disparities Research Award and went through many iterations of that before getting it. And so by the end of this talk, I hope to share some of my advice on these grants. So the grant process is really more of a grant cycle. And it starts with really defining the grant landscape. What is out there that can match your research? And then once you define that landscape, you have to do some research on the details of those grants. Then there's obviously the preparation and the actual application, the award, and then managing the grant, closing it out, and then more than likely advancing to another grant for a bigger project. This talk, though, will be focused more on this half of the circle, defining the landscape using the SSAT Career Development Award as an example, the research details that I think one should pay attention to, and the preparation and the application and what happens once you click the submit button. Well, number one, how do you define the grant landscape? Well, every organization, every society, every federal agency has a website. And the SSAT website is there to go to because it has all the information that you need for all grants. And for those who haven't been to the website yet, there is a header, Grants and Awards, where you can click on the grants program and you have an entire list of all the available grants through the SSAT. And the SSAT has incredible opportunities, especially for young investigators. Now, this website is the SSAT's. If you go to the NIH website, it is very similar, where there are multiple levels of grants and lists of grants that you can apply to for each center or institution. So if you click on this 21 awards calendar, it'll take you to a PDF where it has all of the applications and grant opportunities for the entire year. And it's listed in chronological order to help you keep organized. And you can see that it's an entire list of grants. Now, my advice when you go to these pages is, number one, you have to read the RFA, or the request for application. That's incredibly important. Then you have to look at the deadline. And a lot of work for grants happens at this stage, reading the details before you do any more work in terms of applying for that grant. And the big question I think you have to answer is number three. Once you read those details, does it fit you? Does the Career Development Award fit where you are right now in your career? And if the answer is yes, then you should absolutely apply. Many of my mentors have always told me that you have to go to bat for these grants. You can't just sit on the sideline. If there is an inkling that you can put something together and you have good mentors who can tell you what to do, and you have all the requirements and you're eligible, you should apply. The worst that happens is you don't get it, but you learn from the score, you learn from the review, you learn from all the language that you've put together for that grant that can actually be used for future grant applications. And so this is really my advice at this stage. So if we look at the SSAT Career Development Award in particular, obviously we all know the deadline is next week. But when you click on that, you get much more details. And so this is the page for the SSAT CDA. We have the deadline at the top. We have past recipients that you can look at. And then you can have the online application itself. Now, what's important for grants when you read these RFAs is the very top of the grant, the eligibility criteria. You shouldn't be starting to work on this grant if you're not even eligible, obviously. But there's a reason it's always at the top. Now, the SSAT CDA has specific requirements. You can't have an R01, you can't have a K award from the NIH, or similar career development awards from other major surgical societies. And I would say that there's sometimes some confusion as to whether or not you might be eligible. So you have an internal K award. That was something that came up a few years ago. In those situations, it's good to ask. You can ask the SSAT Research Committee. You can ask LK, who will get you in touch with the right person to really assess and answer your question before you even apply. And so for this grant and for all grants, make sure you're eligible. Now, further down on the page for all grants is more information on the actual application. And you can see it's listed here for the CDA 1 through 8. And almost always, grants are very specific in terms of what elements have to be included. I won't go into details in terms of grantsmanship. Dr. Khan will be doing that, but this is incredibly important. And one of my things that I've learned from doing all this, especially when the grants get really confusing, is I literally number my Word documents with a prefix of that actual number. So I will have a 1, I still use underscore, but I'll have 1 underscore, and I'll say full application, 2 underscore CV, 3 underscore research plan, etc., up to 8, where I actually literally write letter from the mentor. This just keeps me very organized within my own folder. Now, once you get through the application, there's also obviously the timeline. And for the CDA, you can see the deadline. You can see that the review process starts pretty much immediately in February among the committee. This is awarded at the SSAT meeting, which will be virtual this year. And then the grant process, the grant period actually begins in the summer. And here's the link, obviously, for the application. But the one advice that I can say, once you are aligned with the grant, once you've made the decision to apply and you're actually preparing the grant, follow that format exactly. And this is where grantsmanship plays a really big role in terms of making your grant easy to read by all the reviewers and easy to understand. So you've submitted now, you've prepped your grant, you've submitted it. What happens now? Well, the grant goes to the SSAT Research Committee. And these are all members who have had grant experience and research experience, but it's a mix of basic science researchers, health services researchers, all different types. And this is what it would look like on my own screen. Once we get the applications, they're queued up, they get sent to all the committee members, and we have a grant award application task button that we can click on that then takes us into each grant. And we can then download every single element of that grant. Now, CDAs are unique in the sense that it's a career development award. It's not just research. And so the categories that we review the grant is listed here. The relevance of the grant, of the research to the SSAT, the significance of the grant, how are the investigators, the co-investigators, the mentors, which are especially important in the CDA. And then there's a career development plan, which is incredibly important. In fact, for K awards, this is 1/3 of the score. And for career development plan, a lot of it has to do with training. And what are the goals that the applicant will be seeking to improve their skills and knowledge in whatever special area? The innovation of the grant, will it change practice? What will it change? The approach, does the research methods, are they appropriate? And of course, the environment of where the applicant is practicing. Will that environment, from the chair to the division director, support this project and support the investigator? And then there's an overall score. And the overall score is, I would say, the most important. These other categories helps each reviewer think about the entire grant application as a whole. But the overall score is the most important. Now, that is scored on a scale of 1 to 9. This is the NIH scoring system. 1 is perfect, 9 is a very weak score. And so the overall score, once it's made, is actually averaged among all the reviewing members of the committee. And so you do get a very good sense for each grant, where they sit in terms of each of these categories and their overall score. And that overall score does determine who is awarded. Now, a little bit more about the score so you can understand this while you're writing your grant. So it is based on the NIH scoring system. And again, 1 is really good, 9 is very weak. And you want a low score, something that's close to 1. Now, this was taken verbatim from the NIH website for K awards and F awards. And you can see that the NIH actually grades K awards within 5 categories as shown there. The candidate, again, the career development plan, the research plan, the mentors, and the environment. So you can see it's actually very similar to what the SSAT uses. And this is some descriptions of how reviewers at the NIH score grants, with 5 being a good medium impact application. This is exactly what the SSAT reviewers use for their scoring. So again, very similar from high to low. And you can see scores of 1 to 3 in the overall category or in the individual categories means a very strong application. While on the flip side, we have the low impact. So there are some strengths, but they're few, or there are major weaknesses like methodological problems to the project. And so your score overall, where it falls, gives you a sense of where your grant was assessed. And I think it's important to know that with each score, there's also a review. So all the reviewers list comments for each grant. And really, I think those comments are very helpful for myself when I don't get good scores on grants, which happens quite a lot, then I look at those critiques, because that's where you learn how to tweak things and you learn a little bit more about grantsmanship and what you can do better. And you can see also, to make yourself score high, it's not necessarily that you have to have the most innovative and outstanding project that no one has ever thought of. Part of it is how you put it together and how you present it to a reviewer. Because I think it's important to know that some of the reviewers aren't, actually many of the reviewers aren't in your field. There's some basic scientists, there's some health sciences researchers. And so health sciences researchers are reviewing basic science projects. And so you need to make it understandable even for that reviewer. So in summary and final advice, I think use the SSAT website, read about the grants, get into those details, and if it fits, apply. And one more thing, if you're not sure if you're a fit, talk to your chair, talk to your division director, talk to colleagues, talk to people on the research committee and the SSAT to see if will it fit in terms of you applying. And that's important too. You're not making, sometimes you don't have to make a decision all by yourself. Know the review process, which I hope to have talked a little bit about. Make it easy to read. That's probably my number one thing. And grantsmanship, which our next talk will focus on. And then understanding the score. I think it always helps to know how the scoring system works, because that's where you can try to make your grant and tailor it to a high impact grant. So with that, I'm happy to take any questions, and feel free to email me with any questions that might come up down the road.
Thank you, Dan. I guess we can get it started a little bit. When you write this Career Development Award, do you think there's a specific type of researcher that we're looking for? What specific research sort of background are we looking for when we choose a person for this award?
So that's a great question, and that's one that is certainly can be up for debate. But the Career Development Award is certainly, number one, meant for a junior investigator. So having a R, having a K, having a Career Development Award from another institution, another society, definitely puts you out of the eligibility, and that's intentional, because we want someone who is, within, young, who has research interest in one particular area, but also, I'll be honest, and this works for the NIH too, it can't have zero publications in that field either. They had to have some demonstration of some proven interest in that area. And publications really do it. It's not like you need 5, 10 publications. 1, 2, I think that just demonstrates your ability to continue to grow in that area. I don't think there's a distinction for the CDA between basic scientists or health services researchers. The science is important, but again, it's not the entire score for a CDA.
That's great. And as part of that, do you think that one category would be then more important than another category when we're choosing the recipient for the grant?
So you mean by the scoring category, the reviewing categories, innovation approach? Yeah, so that's a great question. So, the category that matters the most is the overall. I mean, that overall score is what is averaged amongst all the other reviewers. And that works the same for the NIH. The NIH will give you specific numbers for each of those subcategories, but there is an overall rating for your grant. So I think those categories helps the reviewer think about your grant in different parts. For a CDA, there's a lot of emphasis on actually not scoring everything on the science itself. The career development plan is very important. And so that part needs work too, to convince the reviewer that you have a set plan, you have a timeline, for example, and a degree that you're aiming for, something very tangible and achievable. That really resonates with reviewers and convinces them that, hey, this is going to work. This is going to help this applicant get to that next step.
Thank you. Thank you very much. We have the time allotted for you, so I think we can proceed with our next speaker. Luigi, do you want to present him?
Yes, hi. So our next speaker is Dr. Sajid Khan from Yale University. He will be discussing the fundamentals of putting together a grant application, mainly reviewing grantsmanship didactics.
Thank you, Dr. Katan. Let's see here. Okay, I'm having trouble sharing my slides.
So we can see your screen. So we see your desktop background. So once you pull up your slides, you should be okay. Once you pull up PowerPoint, there you go.
Okay.
Perfect.
Is that okay? Okay.
Yep.
Great.
Perfect.
Okay. First, thank you to the SSAT for this great opportunity to present at this webinar today. And thank you to the SSAT Research Committee chaired by Dr. El Rafai. I'm really been exciting to give this talk, so thank you very much for that opportunity. And, you know, a lot of what I'm going to talk about in the next, 10 to 15 minutes here, is has a lot of similarities to what Dr. Chu just presented so nicely in his first talk. And some of these points are going to be brought home. And I think that just kind of speaks to some of the things that grant writers are looking, or the reviewers are looking for in this grant process. So, I'll start with this slide here. And I would say of all my slides, this is probably the most important of those slides. And this is just what I've learned, at my time about grant writing, and some things that I found to be very important. And, I'd like to share with this audience here. So the first thing, when writing a grant in general, and, what I'm going to talk about here is, going to be more focused on NIHK awards. But, many of those principles will still be applying to the SSAT Career Development Award, which I've also applied for too. And I'll share with you some of my experiences in that regards too. But, when we talk about grant writing in general for career development awards, for RO awards, these are some of the things that I think are important. The first and most important thing is to identify a good research question. And, that question has to be feasible, has to be novel, has to be relevant to the scientific community, and it's got to be interesting. So that would be my first important take-home point for all grant writing. The second thing is to refine your research question. And like Dr. Chu nicely presented, and I've had the same exact experiences as him, is you're not going to get your first grant application funded unless you're a genius like Dr. Matthews. But, for me, it took me many, many opportunities to get my grants funded. So after criticisms that I received from prior grant applications, I was able to make revisions to my research question. And then on top of that, you start applying for these grants early in your career, and then you're going to see patients and you're going to get some more clinical experience. So based on my clinical experience, some of my criticisms from the grant, I modified my research question a bit too. So that's the second important point I'd like to talk about and bring home. The third thing is very important. And, and I can't stress this enough, you have to have the right team of people around you. A lot of people are going to tell you who you should work with, who you shouldn't work with, but you have to figure out for yourself who the right person is, who the right team is for you. And it's a lot of has to do with team chemistry. And if you have the right people surrounding you, you're going to be successful eventually with your grant application. So that's another point I'd like to mention: assemble the right team for yourself. This is an important point. I'm sure many people in the audience know this because we're all surgeons, and you have to budget your time. It's tough, right? We're not in clinic all day long. We have clinic, but we're in the operating room. So you have to budget your time very carefully. And by budgeting your time, that's going to enable you to perform a successful, to eventually have a successful grant application. And you know how to budget your time better than anybody else. Is it early in the morning? Is it going to be some point in the evening? Just doing it between cases, honestly, is not a great time. I would say you have to just budget your time. And the second thing is, and I can tell you this as someone that's a procrastinator myself, you have to give yourself some lead time. There's a lot of work involved in putting these grants together. So you have to make sure you budget your time and give yourself time to put this together. You have to know, Dr. Chu mentioned this very nicely, you have to know the components of the grant application. Whether or not you're applying for the SSAT Career Development Award, which I would encourage those investigators in the audience that are eligible for it to apply. It's a great society, and then the Career Development Award is outstanding. So, but you have to know the components of it, because they're slightly different than, say, an NIH K08 award, or some universities have internal K awards like a KL2. So know the different kinds of grant application components for the award that you are applying to. This is an important point, and do not give up with rejections. And this is something that surgeons, I think, have a tendency to do, because after a while, this is probably one of the things that drives surgery. We want to keep on doing what we need to do, and we think we're ultimately right. But and then sometimes we get maybe, not happy with our rejections. And so the one important thing that I've learned is, and I've learned this from some of my mentors over the years, like such as Dr. Matthews and some other people nationally, is don't give up with rejections. You have to continue to submit and don't give up. And that will be another success. That'll be another important point I'd like to bring out to you guys. Dr. Chu mentioned this too. You should sit down with the leadership in your department and review your career plans, because, I think it's important for your leadership in your department to understand what your career goals are, why this grant is important for you, because that will only help with this process. And the other thing is, this is really important too, because the first couple times I submitted grants, I just did it in my just my little bubble here, and I never really had people reviewing the grant application. But eventually I learned that that's not going to be successful, so you have to have others review your grant application. That can be people at your own university, it could be people at other universities. You should have that done too. And I would say those are some general pointers in grant writing for the Career Development Award, for the SSAT, for major NIH R01 grants down the road. I think those are some important points. So the remainder of this talk, it's hard to talk about how to grantsmanship in a short talk here. But what I'm going to try to do in the remainder of this talk is to talk about the key components for career development applications. And I'm going to use the NIH as an example. So I've received a Career Development Award, an internal Career Development Award through the NIH. And I just wanted to give some of those examples here and use that, which can be used for the Career Development Award for the SSAT. The general process is going to be understanding about the candidate's background, and we're going to get into all this in detail: career goals and objectives, what your plans are for your career development during the award, the research plan, what the research strategy is, training of responsible conduct of research, mentorship and collaboration plans, letter of support, and environmental and institutional commitment. So those are the basic things that the reviewers want to get from your grant, and they're going to ask you for. And we're going to get into the details of some of these components. So the first thing, so let's talk about the candidate's background. So the candidate's background. So the first thing you need to do in this section is to clearly state your long-term goals. And what is your goal? To be an academic surgeon scientist, and you have to show that you're committed to academics in patient-centered research, and because that is what you're going to get your funding for. The federal dollars, probably SSAT dollars. I'm not on the committee for the grants, but people want to see someone that's going to make a contribution to the field in patient-centered research and move the field forward. And you have to be committed to academics, in my opinion, for that to happen. So that is going to be an important component of your long-term goals. Second is, your time commitment. So are you going to professionally incorporate research into your academic career as a surgeon? So you have to show clearly that you're going to be committed to that time commitment. And that's where some of those meetings with your chair and your division chief are going to come into play, I think, in preparation for this grant application. And Dr. Chu mentioned this too. I remember one of my criticisms for one of my grant submissions was they didn't have enough research or publications. And so, so you have to go ahead and do that. And, as annoying as I got, as I had with that criticism, so I realized that's something I needed to work on. And everyone's going to have weaknesses, but I knew that you have to start showing that. And so that's an important thing. So you have to stress the track record for publications and that you're committed to research. That's an important thing to state in this section. And then, importantly, we're going to talk about this on the next slide is what do you plan to gain with this award, with this Career Development Award? Those are the things that the reviewers want to see in this section. So going along with it, there's also a section for the candidates' backgrounds for your plan for a Career Development Award. So it's important to state the objective of your proposal. And this is an important part. This is something that took me a little time to get clear to me, but is your objective is your academic career development. The science is extremely important, but your academic career development is extremely important in these career development awards too. And the story should go something along the lines of how to justify your career development award. So something along the lines of, you've had this background of research that you did during residency or fellowship or fellowship, maybe medical school. So you have to show that you have interest in it in the past. Then you want to show what your training and experience with the award is going to bring you. Okay, so that's an important thing to talk about. And then the last part is the ultimate goal is to become an independent investigator, because these are awards which will ultimately allow you to become an independent investigator. And that's what the reviewers want to fund. And don't forget to leverage the resources of your home institution, because, and a lot of us are at major universities, and you have to take advantage of that. There's a lot of resources that you probably don't even know exist. So look on the website, look to see what kind of resources are available at your home institution. The research plan. And I would say when we talk about the research plan, this is the most important page. This is where I spent the most amount of time when I get to the science, and it's the specific aims page. So in your specific aims, this is something that should take you a long, long time to really get down pat. And you have to be crystal clear and concise in what you intend to do in this specific aims page. You must state the goals of your research, what your expected outcomes are, and what the impact of your research is going to be on the field of science or surgery, or what specific is surgical science. What do you want to achieve? Okay, so you have to be very clear to the reader of what you want to achieve in this section here. And this part is more about the science and less about the career development. So here you're shifting gears a bit too, but you're focused on the science and what is your research proposal going to help do to advance science. You want to present the problem, and we're going to talk a little bit about this in the next page, but you want to present the problem and you want to talk about how you're going to solve that problem. And this is a point that I just mentioned at the start of this slide, but you know what, you really want this section about as good as it can be before moving on to the rest of the research plan, because it's going to really help you with the rest of the grant proposal. So you have to really try to get it perfect. Even though I say perfect here, I put it in italics because my research of specific aims sections are never perfect, but they are pretty good before I move along to the rest of the section, and it will help allow for the rest of your grant to come out more clearly. The research plan, this is the crux of the matter. This is where you're going to put this is where several pages come. And there are some things that the reviewers are going to look for, and one is significance. So what's the significance? Because you want to paint the picture to the reviewer about what has been done so far, what are the existing gaps in the knowledge that are there and that your research will allow to fill, and why ultimately is this an important scientific problem. So the significance, that's an important thing that you're going to be scored with. And Dr. Chu had, in one of his slides, showed significance, innovation, and a few other things. And these are three of those things that I'm mentioning here. The next is innovation. So, you don't want to just do the same thing that someone else has done. You want to have some sort of innovative, new perspective, new angle here. So that's an important thing to do. Novel concepts. So those are some important points I'd mentioned. And your approach, how are you going to accomplish these aims? You have to have preliminary data. So this is something that people also lose points for on their grants, but you have to have preliminary data. And those preliminary data has to be applicable to your research plans. And when you put that preliminary data together, make sure you're clear in your figures and your tables. They can't be so tiny where the reviewer can't read it. You don't want to have the reviewer angry while they're reading your grant. You want it to be crystal clear for them. And, one thing to do is, this is where your lab, if you do basic science research, your lab should be doing experiments to start getting the data. So like for my lab meetings, I will give the residents or my research fellows a hard time to make sure that, in a nice way, of course, that they're getting, that they have the PowerPoints very crystal clear, because that's where your data is being generated. And you might as well have it nice and tidied up before you have to submit the grant. And then it makes it easier when you actually submit your grant. Your design and methods. This is the detailed information of how you will address each of the aims. It's going to go over your overall strategy, the methods you're going to use, and your analysis. And you want to talk about how your data is going to be collected, analyzed, and interpreted. And this is an important point, the second point here. So you want to convince the reviewer that you know about all the nooks and crannies of your experiments. So you want to present to them what you think or what you anticipate your results are going to be. That's an important point, because then it'll allow the reviewer to know that you really know what you're talking about. Your statistics need to be sound. I've had grants sting because we didn't have a statistician involved in one of our more major grants as well too. So you want to have to make sure your statistics are extremely sound. Potential pitfalls, so the reviewers know that things are always not going to go to plan. So you have to have some backup options. So you have to tell them that you have potential pitfalls, and these are the ways you're going to address those pitfalls. And what kind of future studies will your grant generate? And be logical in this section. So this is important. So you want to clearly define a primary mentor. And again, this is a point that I mentioned earlier in those key points I mentioned, but you have to find the mentor that's right for you. People might tell you who they think is a good mentor for you, but you have to figure out who's right for you, who aligns with you, and I think that is the best type of mentor that you can have. Why are they ideal for the role? Okay, but they should be someone that's an accomplished investigator with a track record of success. So you need to start with having a good primary mentor. And then this goes along with the team that I mentioned, right? So then you need a mentorship committee, and you need to have a realistic group of individuals that are, at your university, at least for me, it's been at my university, and who can round out the goals of your career development. And then this rounds out the team finally, and you have to identify key collaborators that are going to help you achieve your design and methods. Letters of support, so you make the process simple. You don't want to, first of all, ask your, I'm sure some of the faculty on this talk have been asked to do recommendation letters with not much notice, and and no one really loves doing that. So the same thing for these letters of support from your mentors and collaborators. Give them ample time to write the letter, make the process easy for them. I think those are important points that I wanted to mention about the letter of support. So in summary, I know it was a brief summary, but these are the points that I found to be most important. But to summarize, so you, to put together a good grant application, identify and refine your research question. Assemble the right team of individuals around you. Manage your time. Know the details and the nuances of the grant application process. So we talked a little bit about a candidate background section with the goals, objectives, and plans, the research plan, and remember, start with the specific aims, then work on the rest of the grant. Significance innovation approach. They'll also score you on your the investigator and their environment. Mentorship. And don't give up with rejections. And that's it. That's what I wanted to talk about here. Thanks again for the SSAT for giving the opportunity to speak here. These are the acknowledgement. This is my team of people here and the funding that helps support that as well too. So again, none of grant applications would be successful for me unless I had these individuals here who have helped become a great team. And I'm very grateful to them. Thank you.
Thank you, Dr. Khan. That was a great talk with great tips. Just for sake of time, we'll go ahead and proceed to our next speaker, and I'll let Dr. Serrano introduce our esteemed next speaker.
Great. Thank you very much. I think we can also answer some other questions that are related to this after Dr. Matthews' talk. So next with us is Dr. Jeffrey Matthews from the University of Chicago, who's going to talk to us about some of the awards that come from the SSAT Career Development Award. Go ahead.
Thanks so much, Pablo. It's a pleasure to be here, and I really enjoyed the preceding talks. There was just a lot of insight in there, and I hope everybody was taking notes, or you go back and get the recording there, because there was a lot of good stuff in there. So I was asked to speak, and I'll speak just very briefly, and happy to answer any questions about what happens. Why do you do these career development awards, and what comes of them? What are the benefits of it? First of all, I will say this was the template. I don't know what this weird font was in the titles there, but that came from LK. So the Career Development Awards for the SSAT have been around since 1987. And in fact, Barbara Bass was the first awardee. She's now a dean, but was a very distinguished department chair and president of the American College of Surgeons. So it's really amazing when you look back, and sometimes these awards seem like they're just little small steps, and they seem like very simple things, but they actually lead to important things. I was the fifth Career Development Award winner for the SSAT. So, why are these awards important? Well, fundamentally, grants beget grants. We get the first grant really matters, and the SSAT Career Development Award was in fact my first grant. I got it in towards the end of the first year of my first faculty job. And I got it based not on work that I had done previously, but I was in a new lab with a brand new mentor. And there was a question in the comments that Dr. Berrien asked about, how do you write a new, grant if you don't have the publications yet? It's sort of this circular step. Basically, I had grants publications and research from previous work. I was with a completely new mentor, but because I had a track record of some publications and I had a good idea and a good mentor, that somehow all gelled together with a little bit of preliminary data, enough to convince the reviewers of the grant that it was reasonable to take a risk on. And let me say that in hindsight, people would like Dr. Khan said, oh, well, he was a genius and look at all the grants that he got. I didn't have any grants at that point in time. And I was exactly like everybody else on this call. I had done a little bit of research in medical school, a little bit in residency, but I was getting a brand new start. And so it really is an important step to go through, and it's important. So, grants beget grants because review committees like to back winners. And if you get one grant, you're more likely to get the next grant. The pilot data that I generated based on my SSAT Career Development Award directly helped me assemble more data for what ultimately became my R29, which was what in the olden times was a K08. And then that directly led to a grant that I then had for another 15 years or so with was my first R01. But before I got my R01, I was already getting other society awards. There was a career development award that came from the AGA that was called the Glaxo Institute way back when, that I got. And actually then a grant that I got from the SSAT plus my K award or my R29 led to me getting the Clues Award from the American College of Surgeons. And the reason that I got these, and these grants are really helpful because they start to fill in a portfolio of funding, multiple sources of funding that allow you to take risks and develop new lines of research. But it all starts with that very first grant. And so I can't say how important it is to get it. But more importantly, perhaps, getting the grant is wonderful and it leads to other things, but sometimes even not getting the grant gets you noticed. You get noticed within the SSAT and other organizations by a lot of reasons. My SSAT Career Development Award gave me the opportunity to meet the board. I got to meet people who were in the senior leadership at the SSAT. I got to make presentations to them, giving progress reports. And so they thought I must be okay and smart enough to review for the Journal of Gastrointestinal Surgery. And that eventually led to getting on the editorial board. And then years later, you become an editor of a journal. It gives you a committee assignment. That was the way that I got onto the program with this committee, was having the SSAT Career Development Award. And then you start to get the speaking opportunities and the panel opportunities, et cetera. But my whole journey with the SSAT began with a Career Development Award. And grants like this really beget your networks. The visibility that I had within the SSAT led to the relationships with a broader group of GI surgeons, and then to broader circles within academic surgery. And this sort of self-reinforcing set of relationships coming out of these grants, whether it was at DDW or over the course of an academic year at the Surgical Forum, at the AAS, SUS, and now the Academic Surgical Congress. All of these things start to feed on each other and help you to develop your network. So they really are worth it. I would argue that the SSAT Career Development Award has an unbelievable batting average in terms of being able to predict and back winners. So here's, this is from the SSAT website. Back on the, 1987 was the first Career Development Award, Barbara Bass, and she became a dean and president of the American College of Surgeons. You see Stan Ashley, who headed the American Board of Surgery. You see lots of department chairs. Neil Seymour was a department chair. You see Rich Hoden was a SSAT president and editor-in-chief of the Journal of Gastrointestinal Surgery. You see Jeff Drebin got the Career Development Award, and he's chair at Sloan Kettering after being chair at Penn. You see Ron DiMatteo here from Penn now. And now, we were so old, we didn't have our pictures put on the website, but now these are the pictures that are put on the website for the more recent Career Development Award winners. And again, you see people who are at different stages in their career, but are very distinguished academic surgeons. Dave Shibata is a chair at Memphis. He got the Career Development Award. And as you sort of go through and get to the current winners, these are the people who are going to have the exact same roles and titles down the line. So you see Dr. Cartman here, you see Ben Shogan from my own department, and they're on their way. You see Greg Kennedy, who was president of the one of those organizations, was the SUS or AAS, I keep losing track. But everybody's sort of moving ahead by the visibility that they get from these kinds of awards. So they really are worth it. You should envision your picture there. I can't believe that it's been 30 years literally this year since I got my Career Development Award from the SSAT. It was a great stepping stone for me. It was a real feather in my cap. So I wish you all the best of luck. I will stop my comments there, and I'm happy to answer any questions.
Thank you very much, Dr. Matthews. I think one of the questions that were asked before online was, you mentioned here that one grant will get you to the next grant by creating some data, but also you can probably apply to several grants with, the same grant to different institutions. Is that something that is well seen by the SSAT or even other granting agencies?
It comes up all the time. Somebody will apply, will send their grant to the SSAT Career Development Award, to the Surgical Infection Society, to SAGES, to multiple organizations, and see, who's interested in it. And sometimes you strike out everywhere, and sometimes you see lightning strike twice. And then you have to decide which one you want to accept. But that's a good problem. As I said in the chat, if you are lucky enough to get the grant funded by two different mechanisms, that's the best possible thing, because you got it. That means you did a great job, and it means that somebody else is going to get the other award. So you're going to be able to, so that's fine. And the idea that that somehow you have to worry about that, just take that off the table. This isn't like duplicate publication or anything like that. Every granting organization knows that this goes on, and that's expected and a good thing.
All right, that's great. We do have one more speaker, and perhaps Pooja can introduce the last speaker.
Yes, that was great, Dr. Matthews. Thank you for your time. Our next speaker is Dr. Evie Cartman from University of Wisconsin. She'll be discussing how to successfully use your Career Development Award, having won it recently. Thanks, Dr. Cartman.
Evie, I think you're muted right now.
Thank you. All right, let me go back then if I can. So I received the SSAT Career Development Award in 2015, and it's definitely been instrumental in my career development and my progress towards independence. It provided significant funding to perform my valuable yet expensive preclinical research and supported my 50% protected time in the Department of Surgery. In terms of my activities to obtain the award, I already had preliminary data from my institutional startup funds, and this preliminary data provided the basis for my Career Development Award application, in addition to defining the significance and innovation that my project would provide to the scientific and clinical community. I also had significant support and advice from my mentoring team in developing and defining the research plan. I obtained advice from previous career development awardees, such as Dr. Greg Kennedy. I also have the advantage at the University of Wisconsin of having an amazing research support team, which I utilize for this application. We have editors for grant review and formatting, graphic designers to help with figure formatting and creation, and a grants office that's really amazing in terms of making sure all the I's are dotted and T's are crossed for the specific grant application requirements. I utilize all of these resources. I also utilize a grant review group in the Department of Surgery where we review each other's grants and critique each other, which I feel is extremely helpful, as it's important to get to the opinion of people outside of your area of research to make sure that your grant makes sense, especially since some people don't do basic science, or if they do basic science, it may not be in my specific area of expertise. Before the Career Development Award, I really didn't have any major funding outside my startup funds. I had no major publications from my basic science lab as a faculty. After getting the award, I was able to obtain a significant amount of data to allow for 2 publications. One is a first author and one is a senior author specific to this grant. And then 4 other senior author publications since then in terms of basic science. I also leveraged the Career Development Award for all of the following endeavors to establish myself as an independent investigator and expert in my area of research. The data obtained from the SSAT Career Development Award was used in over 10 oral presentations at national meetings and several local meeting presentations, and lay the groundwork for my current funding from the NIH in terms of a P30 supplement grant and a K-12 award, in addition to other associated funding. It also provided the foundation for the preliminary data that I recently used in an R01 submission, in addition to a BA Merit Award. And the award also provided opportunities for connections and collaborations, which helped in terms of me becoming a site PI on a phase 1 clinical trial in my area of research with another institution. Given my research expertise established through this award and others, I'm now a trainer on 2 training grants, on 2 PhD thesis committees, in addition to mentoring several general surgery residents, medical students, and undergraduate students in the lab. And finally, I've received several invited lectures on my research, which I attribute to receiving and being successful with my SSAT Career Development Award. Therefore, I really cannot thank the SSAT enough for the support for my career development and my continued endeavors for research independence.
Thank you. This is Pooja Ketan. I just had one question. Do you have any advice as to for people who are in institutions where they may not have enough grant office support, or any way to strengthen their application?
For me, I feel like in terms of sending it to colleagues in terms of fellowship, I did use David Liska and others to help review grants to make sure they made sense. And then in terms of making sure that the figure formatting was appropriate too. So I think using your colleagues from either residency or fellowship or any other aspect of your training is very helpful.
Do we have any questions from the audience that I'm unable to see? LK, perhaps you can help me figure that out. Or any of the speakers?
We don't have any open questions at the moment. All of the questions have been answered so far within great detail in the Q&A panel.
Dr. Putan, I have a question for Dr. Cartman, if that's okay. Evie, excellent talk. Thank you again for your journey and sharing. What were the, if you name the top 3 most important elements in securing your SSAT CDA grant? If you reflect back now, I mean, it was a remarkable journey that you just shared with us. Now you reflect back, what would you name the top 3 elements that you think nailed it for you to get it?
I would say definitely the mentorship team, having some preliminary data to back the research plan and identifying the significance and innovation of the problem.
Thank you. And that speaks exactly for what Dr. Chu, Matthews, and Khan as well mentioned. So it's gelling really very nicely.
Can I comment, Dr. Al-Rafai? This issue of having enough data and getting it all together, you can apply for these awards, 5 times in a row. I mean, if you do it in your first faculty year and it doesn't seem like it's quite ready and the reviews are, not what you want, don't be discouraged. It doesn't mean you don't resubmit it, the next year for the same CDA. There's many examples of people who applied 2 or 3 times and then eventually got it. So, keep coming back with it.
And in this regard, I want to remind everyone, thank you, Dr. Matthews, the deadline is coming up for the SSAT CDA, and I'm thankful for everyone to share their expertise. So feel free to reach out to any of us, and LK has shared the website and the link for the CDA as well.